Yes, so as a patient with ME, to begin with, I didn't really realise what was going wrong with me. I started to feel ill with a lot of sore throats, colds, high temperatures, fevers, even diarrhoea and vomiting and other non-specific pain symptoms. And I tried to keep adapting to that and carry on as normal. I carried on working, I carried on trying to do exercise. But for a good 6 to 9 months, I was constantly modifying my life to try and cope, to the point where I started using disabled toilet facilities. I started wearing different clothes to find them easier to get on and off. I stopped being able to plan a meal, and I couldn't work either. Then I started to get severely ill and I was bedbound. I couldn't read, I couldn't watch TV, and it was a horrendous illness. It causes a lot of pain, a lot of distress, discomfort from sound, noise, light, and it's really debilitating. I couldn't leave the house, and when I finally did, it was in a wheelchair. So I went through seeing 13 different doctors before I was diagnosed. I'd started getting ill in September 2016, and I didn't get a diagnosis until July 2017. So it was nearly a year, and in that time I had been back and forth to the doctors, the hospital. I'd had various scans and investigations. And in the April 2017, I'd even been tested acutely positive for glandular fever. And despite that, and looking at the guidelines online for ME, I still didn't believe that that's the illness that I had, because what I was experiencing was very physical. So before ME, I was fit, active. I used to cycle a lot. I used to run regularly, 10 kilometres. I have 2 young children, really enjoy doing things out and about with the family. I also have a wonderful job in the NHS doing skin surgery. So extremely active, full life, full social life. And then since having ME, to begin with, I couldn't do anything at all. I couldn't read, I couldn't watch TV, I couldn't even answer my emails. And later, as I started to get better, I was in a wheelchair to enable me to get out of the house, but largely spent a year and a half housebound, going out very little. So totally life-changing. I couldn't work for over a year, and it's taken me a further year to work up to just doing 2 afternoons a week at work. It was really difficult. At times I couldn't spend more than about 10 minutes in a room with them. It was so hard for me, and in fact at my worst my parents took me to their house to be nursed for 4 months, because even just spending an afternoon with the children would exhaust me. It would take me days to recover, and when I say recover, I was in bed, not even going downstairs to have a meal or anything like that. I just was wiped out.